The new report is raising concerns about Black mothers and heart failure. The American Heart Association says non-Hispanic Black women may be more than 3 times as likely as white women to develop dangerous heart failure during late pregnancy or postpartum. Now questions are being raised about why. Family physician and health advocate Dr. Bayo-Curry Winchell is joining me now for more on this. Dr. Bayo, thanks so much for coming on. You say that it's bias, not necessarily just biology, that drives these disparities. Why?
This is happening across states across the country. We are seeing Black women dying at the highest rate, whether it's suffering from heart disease, whether it's dying at the highest rate while giving birth. And bias is contributing to that factor. When you are not able to see pain or really find a way to understand when someone's saying something's wrong, that impacts health outcomes.
Now, even as a physician, you had your own near-death experience during childbirth. What was that like for you, and how frustrating is it to have this happen, even as a professional who knows the right terms, who has the expertise?
It's very frustrating. I went in to have my second child, just excited, and I knew after delivering her something was wrong. And I shared that with my nurse. I said, something's wrong. And I was dismissed. And again, I said, no, something is wrong. And as you can hear in my voice, it still impacts me today. I found out that I was internally bleeding and I was hospitalized. This happened in the hospital that I'm a medical director. So when we talk about bias, and we talk about Black women dying at the highest rate, I am a part of that. Nearly died in the hospital. And so if this can happen to me, it can happen to any Black woman across the country.
So how do you think bias factored into your circumstance, even as the director there? They know you, they know you're an expert. And how do you take that and then give people who aren't necessarily an expert, right, and who aren't known by the staff there, how do you then get actionable solutions to fix this problem?
In the end, although I'm a physician, I was a Black woman. And when I shared something was wrong, I wasn't listened to. So what can you do? You have to speak up. And when your questions aren't being answered, continue to speak up. Advocate for yourself. You know your body best. And also think about bringing a trusted friend, a family member, anyone that can be your witness and help support you is huge.
And what can families do to advocate for better care in general, not during childbirth, but also throughout the pregnancy in general? Because these problems can pop up even before childbirth and also right after.
Really lean into finding a clinician that listens to you. If you do not feel heard, if you feel dismissed, find a new clinician. Continue to ask questions and utilize different ways of things that are in the healthcare system. If you're not being heard, say, is there somebody else that I can speak to? Also, another big thing is asking questions. Continue to ask questions, continue to speak up. I did that as a physician and it saved my life.
All right, Dr. Bayo-Curry Winchell, I'm sorry that that happened to you. I'm sure we all are, but also glad that you're now turning it into this way to spread this such an important message. Thank you.
Thank you.